We are getting a first look at the Wuhan virus. Take a look at this. This is microscopic image. These are images showing the actual virus extracted from a patient in Wuhan, China. Wuhan itself has become a fortress under siege. Its citizens barred from leaving. I want you to take a look at what they're doing.
Yeah, anything could happen, Bob, because we're talking about a virus that spreads quickly. And people are saying, and this really surprised me, that the virus might not peak until April or May of this year.
What's the worst case scenario here?
Worst case scenario is the numbers that are getting out of China. We actually find out what's really going on there. But I don't trust anything that they're saying.
And hang on a second. We want to go to Los Angeles. There's a plane that's landed there from China. They're holding a press conference. The plane coming from Wuhan to LAX.
And we were asking that about maybe a week and a half ago when we first started hearing that, because we saw video and photos of people dropping to the ground, and we continue to see the numbers skyrocket.
And he says there's no vaccine, no therapeutics. In other words, no real treatment right now.
Right.
And we don't know how bad this might be. And we are seeing a lot of people freak out about what's going on with the coronavirus. Here's a video from the New York subway of somebody reacting to someone in a mask. Take a look at this. How threatening is this virus?
This virus overall in the entire world has killed only 400 some people. So yes, it is quite worrisome. It is a novel virus, and it is not behaving like other coronaviruses.
What's the best way people can ensure their good health? What kinds of steps should they be taking?
Wash your hands, Bob. I mean, we say it over and over again because it is that important.
Turning now to the coronavirus outbreak, 65 more people on that cruise ship in Japan have tested positive for the deadly virus. 11 Americans are among those new cases. The ship now has a total of 135 infected passengers, the largest cluster of cases outside of Wuhan.
People being held up for, 14 days for the incubation period. Is quarantine the best method to prevent the spread of this outbreak?
Quarantine is a good method to prevent any infectious disease spread. So, yes, the answer is yes.
Even the Fed chief the other day said it could start slowing down the global economy. That should only be happening because the numbers are significant.
Well, look, a couple of weeks ago, most American airlines, American fly carriers said they weren't going to go into China anymore. The Chinese Communist Party said, oh, you're not being fair, you know what, but turns out it was the right move.
Watching Wall Street right now as the Dow Jones is crashing amid a surge in coronavirus cases outside of China. Take a look at this drone video from South Korea. In a moment, you'll be able to see a coronavirus concerns and people lining up for miles to buy masks.
This virus is very worrisome. It's spread to so many countries. But the fact that we're seeing deaths so early means it's already been spreading in each of these countries unchecked for several weeks, and that's worrisome.
There's some breaking news about the coronavirus concerns in America. Right now, there's a person being tested in Virginia. Air travel demand will fall for the first time in more than a decade, costing airline companies more than $29 billion in revenue.
Well, that $29 billion figure that you just mentioned is probably going to be on the low end because you're dealing with every aspect of the travel industry, hotels, not just airlines, cruise lines, retail, restaurants, spas, resorts, rental cars, and then all the associated jobs along with it in indirect other industries.
Gosh, I don't know about you, Joe. It literally gives me chills watching that. You see the date in the top corner, that's from February. It's just one of those moments. If we knew what we know now then.
Well, I mean, again, just what did we know? What did we think we knew? It's just those known knowns, unknown unknowns. It's just it's a whole cluster of disaster that's been brought to our doorsteps. And I think we have someone now to tell us a little bit more about where we are today.
We do. To give us a little bit more insight on that review, Newsmax medical contributor and author of The Ultimate Manual, Dr. David Samadi. Dr. Samadi, we thank you so much for joining us this Christmas. You know, watching that review, hearing about the different things between, is quarantine going to be effective? Should we be wearing masks? People fighting over masks, shortages, will it affect the economy? Do you think this just, you know, gosh, looking at this months later, did it spread so much faster than we thought it would?
Well, first of all, Merry Christmas, and wish you and the rest of America a great year ahead of us. this was something that now we know that has been around since probably August or September of 2019. It started off by saying that this came from the wet market, and there's a lot of suspicions and a lot of talk about the fact that maybe this was developed in a lab. Clearly, this was not a very bad flu case that we thought it was. The best decision that was made was by President Trump by blocking and banning the travel from China. I think it's extremely unfortunate, and it was just a horrible decision that the country of China allowed the planes to come out of Wuhan to the rest of the world. The rule of infectious disease is containment, blocking the virus and bacteria and the infection exactly where it is. And there was a leak out of that country, and as a result, we know that millions and millions of Americans and the rest of the world got affected by this, and economy collapsed and the rest that you already know. Since then, the American healthcare system, our scientists, our doctors, and credit to even the public that were very compliant and followed everything that CDC and the rest of the public health policy makers decided, we've been able to control to some extent this disease. We expected to see, based on all the models, over 2 million deaths. And even though every life matters, unfortunately, we lost about 300,000 people as a result of this virus. If we could have done a better job, a lot of patients should have been kept away and outside nursing home. They should have never been put back in there. So a lot of mistakes was made in New York, in LA, and many other places. But this is it was a novel virus, and we didn't know exactly who it was going to go after. But look, in the course of a year, we equipped all of our hospitals. We got the ventilators. We started to have so many medical and therapeutic treatment for this virus. And yet, only 9 months after, as a result of the ingenuity of medicine and science in this country, we have 2 vaccines. What a ride it was, a difficult and challenged ride. But I am very optimistic that moving forward, we will beat this virus and we'll move forward.
Doctor, quickly, got about 30 seconds here. Is there anything that you think that still remains for us to be able to focus on as we look to get through a successful vaccination process here? What are the things that can thwart the tremendous amount of work that's been galvanized here to the medical community?
There's always some skepticism. There are some people that are anti-vaccine, and they just don't want to get it. And I think that if we are over at the age of 65, those are the people that we should focus on. Our nursing home people, doctors and emergency room doctors and nurses that are exposed to this virus should be concentrated more. And the 30-year-olds, 40-year-olds, and 50-year-olds can wait a little bit until we get to them. The program is doing very well. We have already vaccinated over 1 million people. And I think as we turn the corner in 2021, we're going to get probably another 2 vaccines coming in. And by March or April, I'm hoping that we get some form of pseudo-normal life back in America.
Absolutely. Dr. David Samadi, thank you so much for joining us. Merry Christmas. Coming up, we'll be back with more American Agenda right after this.